Assalamualaikum warahmatullahi wabarakatuh. Hello, everybody. Thank you very much for the opportunity for me. Here now, I want to present my article titled "Strengthening Community Empowerment for Elderly Healthcare New Normal" with Pol-Sadar. This is the online integrated healthcare post for elderly, and I am Hani. Well, everyone, the health of the elderly today cannot be ignored because Indonesia is going through an aging population phase. And we can look at the data of Indonesia, and I want to highlight the prediction of population of aging people in Indonesia 2035. There will be 15.8% of the total population are elderly people. Well, um, with a global aging population, every part of community plays an active role in achieving a world where elderly people can live well. Before the pandemic, elderly people actively participate in every integrated health service post, or we know as posyandu activity in some districts, uh, specifically in Central Java. This high participation is due to community health workers, of course, who understand their role in realizing basic health services. But during the pandemic, Posyandu must be held with attention to developments in the COVID-19 cases. Based on this, um, we implemented Pol-Sadar, the online-based service of integrated health service post for the elderly, which aim to provide health services for elderly people in an online way. Well, this paper explains the participation of elders, the family, and community health workers in the revitalization strategies of integrated health service activities for the elderly during the pandemic. And let's move on the method of our program. Well, the activities included health assessment, via telemedicine, such as video call, and then drive-through services for vital signs assessment and also simple lab checks, and also home visits if needed, and education via WhatsApp as needed or by phone. The implementation of Pol-Sadar began in June 2020 and also May 2021 with 184 elderly people in some places in Central Java, including Semarang City and also District of Semarang and District of Batang. We also work with teaching volunteers consisting of community health workers and also students of nursing in the community. Well, let's move on the results of this program. The result of these activities were the finding of health problems experienced by the elderly during the pandemic, such as depression and the high prevalence of hypertension in elderly and joint stiffness. And also about the increase of knowledge and physical activity that done by the elderly group. The elderly are a group, I'm so sorry. These are the figure describe about the uh, development of knowledge and also the health problems before and after the intervention. And we can state it that the 100 all 184 elderly people that who participated in online health education and also exercise activities accompanied by their families, they felt a decrease in complaints of joint stiffness. Then the 84 elders people participated in health education and exercise activities in open areas by implementing strict health protocols. Most of the participants said they were satisfied with Pol-Sadar activities as a health service strategy for the elderly during the pandemic. So we can state it that the elderly are a group that is more susceptible vulnerable to being infected with COVID-19, which means it is even more important for the elderly to practice physical distancing. And we know that complete isolation indoors can reduce the mobility of the elderly and people who belong to vulnerable groups. And it may help some health problems, of course. Posyandu for the elderly as a community-based elderly health service that is carried out online can be an alternative in maintaining the health of the elderly during a pandemic. Prevention efforts are carried out with health promotion strategies. This program emphasizes on strengthening communities that include the elderly and also elderly families, and of course the community health workers in achieving these goals. The quality of partnership, collaboration in partnership, and also the monitoring evaluation that systematically and meaningful results uh, give us a some positive impacts in the implementation of Pol-Sadar, the use of online media, and also this provides convenience in participating, sharing, and also creating positive relationships. So we can conclude that the online integrated healthcare post, or we name it as Pol-Sadar, Posyandu Lansia Daring, was effective as a strategy of health services for elderly people, especially during the new normal era, and increased the participation of family and also community health workers. In its implementation, we should aware that Pol-Sadar requires the participation of community health workers and also elderly families to be able to assist the elderly in consulting health with health workers such as doctors, nurses, and also the other health workers. Adequate tools such as smartphones and internet networks are um, also needed to support the participation of elderly to participate in this program. Well, that's all about my program. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.